Good morning, everyone. Today, we're going to be doing a presentation. My name is Christine, and I am with Solva Senior Living. Hopefully, you all can hear me. Um, the way that these types of presentations work, what you just need to do is, um, hmm, just a minute, I'm having a bit of a technical thing going on here. There we go. So you can, there's a box at the bottom of the screen. You can make comments, you can ask questions, you can raise your hand. Sometimes I can see these things as I'm going in through our presentation, or I'll just make note to kind of check in. I just want to ask if you can hear me and if you need anything. So if you want to go to that little box and just raise your hand if you can hear me. Lovely. Awesome. I can see all your hands. So if there's anything you want to me to answer along the way, I'm sure there's going to be a few things. Just raise your hand and we can chat. Okay, so I'm just going to lower that. So today, we're going to be talking about navigating senior housing in Ottawa. Not senior housing, senior living and aging at home. We're going to spend a lot of time on aging at home and a lot of time on planning and help you try to kind of maybe give you some tips and tricks that we've learned along the way from other people. So here we go. I'm going to tell you who I am. Who am I talking? We're going to talk a little bit about the psychology and sociology that we've come across. I spent a lot of time talking to people about that. We'll talk about 6 different things that people need to look at when aging at home. I am going to chat a few minutes on seniors housing because I think it's important to kind of round out the conversation, and then we'll end with some planning tips. So my name is Christine. I've worked in seniors housing and care and elder care for more than actually 25 years now. I've managed retirement homes, worked at home care agencies. I've spent a lot of time building relationships with a lot of the professional people in the geriatric world. So I have a lot of knowledge about how both senior housing works and aging at home. And I've also helped thousands of people navigate how all this works. I created Solva about, I want to say, 2013, really just to allow people to tap into what I know about this industry and to help them save time. So there's no way a sales pitch. I don't try to convince anybody to do anything. I just like to share the information that I know. So that's just it. That's what we do. We just advise people, provide them with guidance, giving them resources, referrals to things. Our service doesn't come with any obligation at any which way. Just by calling us, we will help you kind of figure out your individual situation and point you in that right direction. And so to learn a little bit more about us, if down the road, and I promise this is the last time I talk about this, it's solvaseniorliving.ca. So, understanding the psychology of aging. Why does anything have to change? What are the factors that require change? Why are we resistant to change? And what do our adult children think about change and why? So these are kind of common psychological questions that I talk to seniors about, or adult children, or my peers. We kind of have these conversations. To start with, why do things have to change? As in life, we're always changing. But for seniors, there's a lot of different things that go through perhaps challenges, more so things with mobility or physical or cognitive. Things don't have to change. You can age at home. So there's lots and lots and lots of programs to stay at home. You don't have to move. So a lot of people think, if I get older, I'm going to have to move and they're going to, force me to go somewhere. That's not the case. There are benefits to moving. Absolutely, there are benefits to moving. But if you want to stay at home, there's things that you can bring into your home to allow you to stay there for as long as possible. The key and the trick is that the key and the trick is to not be in denial about your changing physical or cognitive needs. The more you can be proactive in terms of planning, the more you will be in the driver's seat. So, you hear the stories of somebody kind of went to the hospital and the hospital said, you can't go home. Well, that's because most of those times people kind of avoided, and of course there's going to be times that something just happened quickly and it was a crisis. Those things happen. But there are people out there that if they would have planned and they would have put some things proactively in place, when they were, more physically or cognitively well, they could have potentially stayed in their home longer. That's not to say that their home is in any which way the right fit. There are lots of homes that are just, completely inaccessible. So I'm going to get into this. So just give me a sec. What are the factors that require change? We're going to talk about that. There's about 6 or 7 reasons why a senior might end up at the hospital, of which getting that talk with the doctor saying you can't go home. So I'm going to get into that today. And then the interesting, or the big one, is why are we resistant to change? So seniors, and this is just about having that kind of insight into ourselves, but there's a lot of loss. So seniors do experience a lot of loss. As we get older, we're losing friends, we're losing family member, we're losing maybe our ability to drive, which could be perceived as a loss of independence. We might be losing our sight, our hearing, which then also presents a loss of independence or freedom. And ultimately, at the end of the day, our house is sometimes one of the last big things that we have the ability to control. So being aware of that, are you staying in the home because you feel like, this is a place that I can control, it's safe and secure? Is it safe and secure? Why do you want to stay in the home versus maybe looking at something else that might be more accessible or give you the benefits of which we're going to talk about today in terms of those reasons people fail to cope. And what do our adult children think about change and why? I mean, I think it depends. There's 2 polar opposites. I've met adult children that are, in complete denial and don't put anything in place, to help support mom and dad in the house. But then I've met many more so adult children that just really want the best for mom and dad. They want them to be safe. And the truth is, with the adult children, if they're not spending all their time coordinating things for mom and dad, then you're really able to spend more time visiting and spending that quality time. Whereas often later on in life, the adult children are, taking mom and dad to appointments or coordinating appointments or worrying that they're okay and that sort of thing. I'd like to see, and that's maybe the reason why Solva exists, is so that, the families or even the seniors don't have to spend all this oodles of time trying to research how this all works. That they can just call us and we'll point them in that direction so they can spend more quality time with each other. Okay. So this is it. Understanding why seniors want to move and why they have to move. So there is a whole group of seniors that want to move. They want to move because, they want carefree living, they want maintenance free, they want to downsize in advance, get rid of the things so the family don't have to take care of it later. They just want freedom. Okay. So there's a whole group of people that are just proactively making those decisions. Then there's others that are just resistant and, I just want to stay in my home and so on. So those are the guys that we need to put that we want to encourage to put plans in place so they don't have to move. Nobody wants to be told they have to do anything. So if you make those plans and are aware of the reasons why you might have to move, you can put those plans in place. So these are kind of the 6 reasons. The biggest one that I feel is the social isolation. Being lonely is the one on the top that I think is kind of like the catalyst that everything else trickles down from it. Then you go into poor nutrition, not eating properly. Poor nutrition can lead into a multitude of things: medication management, forgetting to take your medication. Your physical, cognitive health can decline if you're not eating well. And then you could be more susceptible to trips because you're becoming more frail, trips and falls, risk of emergencies. Do you have the emergency support in your house? Is your home accessible? So these are kind of my 5 reasons why somebody might fail to cope. And then you do definitely add in health conditions that decline. They kind of sit in here as well, and cognitive decline for sure. But there's lots of things you can put in place to stay at home, knowing these things in advance. Let me keep going. So pre-planning and prevention, making sure that you've got social supports, your home is accessible, you're eating well, proper nutrition, you have got assistance to take your medication. And I got to caveat the medication management thing, because a lot of seniors, it's like a stereotype. A lot of seniors think, oh my God, I forgot to take my pills and now I'm old and they're going to, deem me as having dementia. No, I forget to take my medication too. So do a lot of young people. This is not a senior issue. It is just an issue. Except for when you are a senior, you may have more medications than somebody younger. And those medications are like more required. You really can't forget to take those, because the outcomes are much more critical, right? So for somebody like me to forget to take my medication, which I do a lot, and my doctor gets mad at me, but it's not as critical. But if I'm 85, forgetting to take my medication can lead to a number of things, right? So then you've got your physical health, making sure you're active and you're not deconditioning and those kind of things. And then you have a plan. What if something happens to me? You have a plan. So aging at home, here we go. Social isolation. You need to have a reason to get up in the morning, period. I once spoke on Zoomer Media. They brought me in to talk on the Zoomer, one of the TV shows they put on, and it was talking about centenarians and that we have more and more people living to 100. And they asked me to reflect, because I've met a lot of seniors along the way, and they said, can you reflect on, what's common between people aging longer? And one of the big things is having a sense of purpose. Oftentimes these people that are rocking, 90 and 100, they have a reason to get up in the morning. They don't necessarily feel themselves to be old. And they've got a sense of purpose. Now that sense of purpose is going to be different for everybody. So there's not like, you can't just go, okay, I'm going to go buy a sense of purpose. That doesn't exist. What makes you happy and what makes you tick is individual. And so if you're at home right now and you're watching this, you might be asking yourself, okay, like what can I do that will give me that sense of purpose, that will make me feel valued, and that will really, drive me to get up and get dressed every single day. So some of the things that could be like volunteering, even having a second job, working somewhere, learning. There's a great group of people that are just like forever learners. Carleton Place has a great learning and retirement courses. Maybe babysitting grandparents. They do say grandparents do live longer because they enjoy the children. Gardening, caring for just about anything, a dog, a cat, fish. You got to walk them. You got to feed them. Writing, social programs, activities, travel, whatever makes you tick, but you have to have a reason to get up in the morning, period. And for those seniors that lose that, that's when we start to get into that social isolation, right? They might have been a volunteer and went out and did Meals on Wheels. Oh, we had a fall. I had to get my hip or knee. It's been a bad winter. Now I can't do that anymore. So you can that's when the social isolation can start to creep in. And that isolation can then lead to depression. It can lead to with becoming withdrawn. And then what happens is, oh, one day I'm just not going to shower. I'm going to wear my pajamas all day. Then that one day leads into a week. That week leads into a month. And it's a slippery slope. So making sure you have a reason to get up in the morning. Eating well. This is difficult. And it's difficult for lots of people. If cooking for one is difficult, you need to find other options. Meals to Wheels programs, Wheels to Meals. That's where they come pick you up and take you to kind of a group thing, which is a social opportunity as well. Which unfortunately, because of COVID, that's not happening right now. So we need to be a little bit creative. Then there's Meals to Wheels. Oh my God, it's a tongue twister, isn't it? There's other programs like Heart at Home. They do frozen meals. Socializing at meals is key. Also, it's like a double whammy. These Wheels to Meals or finding opportunities to eat with other people is a double whammy. It's key to social isolation. If you are an older senior and you're a little bit more frail and you need some home support to come in, I always love the idea of a program where you've got, a home companion type of person that comes, takes you grocery shopping, then you cook a couple meals for the week together, and you're spending that social time and you're making food enjoyable as a kind of an activity. But you need to be aware that you can't eat toast or high sodium or frozen food that like out of the grocery aisle. That stuff is not healthy. And, it's one-offs every once in a while. Okay. But every day, all day, that can create some real health issues. Physical activity, again, we all know it. We all know we should be moving. They say if you don't use it, you lose it. But you have to stay active. You have to. Even somebody my age have to start moving 30 minutes a day, get a fitness tracker, whatever. Now it's tough. COVID, we're coming into winter. You have to, there's lots of virtual programs out there for chair exercises. And my family certainly uses, we have a smart TV. And so we can get YouTube on the TV. And there's all kinds of exercise, 30-minute free exercise classes of all kinds. Like you could learn how to belly dance in a chair if you probably wanted to out there. So finding ways to move every day is very important. Medication management. This is interesting and fun. Well, not fun, but you need to develop a reminder system. So we know about dosettes. The pharmacy will put your medication in a dosette, so on and so forth. But what happens if you forget to take the dosette? So there's all sorts of medication tools out there, like from alarms so you've got your medication bottles there to a timer alarm that sits on the top of the pill bottle that will sound when you're supposed to take it. There is dosettes that have alarms on them. So you preload the medication dosette and it'll ding, it'll flash saying, take it now, take it now. So there's lots of different things. One place to just go and check them all out is to go to Amazon and put in medication reminder, and a whole bunch will come up. Fall prevention. Okay, this is a big one. This is the house. This is what I talked about earlier. Your house, as much as you want to stay there, it's the homestead. It's where you raised your family. If your home is not accessible, like you have to climb, 3 flights of stairs to get to the only bathroom in your house, then that might not be the best place. And unfortunately, outside of spending lots of money for renovations, it might make most sense to, downsize from the big house and go into a condo or go into an apartment or go into a retirement residence. But if you are young enough and your home, it can be, modified, there's lots of stuff that you can do. So, and I would just start right now, especially if we got younger seniors on the line here. There is this great document that AARP in the US has put out in terms of assessing your home for accessibility. So I'll make sure you all get this link. Let me see what will happen if I click on it. There we go. You can see what I'm talking about. Moment. Yeah, so home fit guide. So you could print this off and it gives you all sorts of ideas and tips, things that you probably wouldn't even think about. And sometimes there's small upgrades that will even actually add value to your house. Things from lever handles to adjustable shower heads, carpeted steps, lighting, certain kind of lighting in your house. Lighting's a big one for sure in a house. And so are a number of things. One of the OTs that I once worked with always recommended putting an extra handrail on the other side of the stairs going down to the basement, bringing your laundry upstairs, just little things. But I'll make sure that you guys get this. See, it has like a little bit of an audit here that you can go through. And I think this is talk about planning early. This is one of those tools that you do now before it becomes critical, right? Because you want to take the carpet that is a trip hazard off the floor before you trip, right? So, okay. We talked about this home modifications. I'm going to send that to you. Railings on both sides of the stairwell, grab bars in the bathroom, walk-in showers, anti-slip flooring. They have anti-slip tiles that you can put down versus slippery tiles. So if you're doing a renovation, if you're younger and you're talking about doing a bathroom renovation right now, thinking about these things in advance before you need them. And that's what's called universal design. It's nice, but it's accessible for everybody. So if you decide to sell your house down the road, your bathroom's beautiful, but it's also very safe for you. What happens if I need more help? So even before this, I want to say a couple things. Emergency support. You need to have some level of like emergencies. We've all heard the stories of, my neighbor fell and was on the floor for 3 days. Yes, that happens. That actually happened to one of my neighbors. And, he went out and got one of these alert button things that have fall detection that could detect him going down. There's a bit of a stigma with that, right? Like for younger seniors, it's kind of feeling, am I now perceived as old to have this? Now, I think it's more of a safety device. If you're living alone entirely by yourself, having one of these things, especially for when you go out or when you're in the house by yourself, you always know there's somebody around with that button. There's always something you can do. What if I need more help? So who has a plan if there was an emergency while you're at home? Yeah. So do your family, does anybody know what to do if something happens to you? Do you have this written down? And if you have it written down, do people know where it is? Is it easily accessible? One of the little tips and tricks I like to tell people is the easiest thing you could do right now is write down all your emergency contacts, your medication, your doctor, put it in an envelope, put it on the fridge, and write 4 emergencies. And, paramedics come, they grab that. Something happens to you, they can just grab that. You know where it is. You don't have to fish it for it. You don't have to find it. There's also those things you can stick in your wallet. But the thing on the fridge that blatantly says for emergencies or if something happens to me, it's just, here it is. I've got all the information. Same with like who your lawyer is, where's your will, that kind of thing. Yeah, do you have the emergency contact card in your wallet? And so on. What support services are available in the community for me to stay at home? Let's see. Oh, okay. Oh, I gotta go back. Moving forward. There we go. So there's lots. The LIN, the Local Health Integration Network, formerly called CCAC, they provide some funded home support services. You don't need a referral from the doctor. You simply call them. And like I said, it's called the LIN, LHIN, and they will do an assessment. And if you do require help with a bath or help getting dressed or help with anything, they can supply some funded services. Meaning they'll send somebody to the house to help you. The Veterans Affairs also has a program called the VIP program. They have, they do things like, you know, housekeeping, snow removal, that sort of stuff. You would call Veterans Affairs for that. Community, there's lots of senior centers across Ottawa, and they often have programs called community support services. And then those centers, those community support programs have things like, let's call them subsidized services. So like more economical housekeeping, snow removal. They have like a telephone assurance program. So if you are living alone, somebody will call you every day to check in, have a chat for 15, 20 minutes. They can help coordinate. They had the Wheels to Meals programs and stuff like that. There's programs called Primary Care Outreach Team. Those are located at the community health centers, and they take care of like the most frail elderly in the community living at home or in an apartment. Those are nurses that go out and advocate. There's the Regional Geriatric Assessment Team. They come out and assess, you know, mostly it's cognitive, but they provide assessment and referrals. If you ever want a list of those kind of things, just give us a call at Solva, and we're happy to share with you a list of those kind of services in the community. You know, for the helpline, those buttons, you know, fall detection buttons and emergency support buttons, there is a local group called the Red Dot. They're run through the Briere. And if you call them and you need that service and you mention Solva, you'll get 1 month free of those services. And that's a great little device. Actually, it does more than just the personal alert. They have voice two-way communication and fall detection. So if you're wearing the button and you do fall, they will talk to you no matter where you are. You could be in the middle of the woods and they'll talk to you. They'll know where you are. It's GPS. But they also have fencing. So if you are caring for somebody with dementia, this little button not only detects falls, it will GPS tell you wherever this person is if they're wearing it. And you can put a kind of a fictional fence around your house or wherever your neighborhood. And if they're gone walking and happen to go outside of this invisible fence, you'll get a text and you'll know where they are. I think that's kind of neat. That gives lots of peace of mind. And they also have inserts into shoes that also has GPS on them. So you'll always be able to find the individual if they get lost. There's all sorts of tools for dementia care at home. One of the ones that I think is mostly underrated, but it should be used the most, is automatic stove shutoffs. You can put alerts on doors, stuff like that. Like the Rogers Home Security stuff is pretty good stuff in terms of monitoring what's going on. But again, that's kind of stuff we do with Solva, is we help walk through, we talk about your individual situation, and then we kind of here's some of the services that I think you should look into. Just a little bit on, I just want to check in with you guys. Anybody have any questions? I'm just having a look. Okay, we'll keep going. No questions. Oh, maybe there is chat. Oh, perfect. Good. Okay. We're going to keep going. So there. Senior housing. I always like to round out an aging at home presentation with senior housing. Oh, I do have a question. 1 second. Why can't I open it? I cannot open the Q&A. If you could send it in the chat, I'll get it that way. I don't know why the Q&A won't let me open. Okay, we're just going to keep going, and I'll do the Q&A at the end. I'll try to figure out why it's not opening. Okay, so I always like to round this off with housing, because I think you need to know what all the options are. When I say senior housing, that actually means your house. So doesn't mean retirement home, doesn't mean long-term care. See, your house is in the middle of a senior housing conversation. So if we want to stay at home, we got to put plans in place in advance. But then there's other options too. Maybe you're like, my house is like 4,000 square feet and I live in 2 rooms of it and my stuff lives in the rest. Oh, here we go. Okay, that's interesting. Solva is actually, Solva only exists in Ottawa, so unfortunately, but we can try to help you anywhere, or point you in a direction. We'll try. We'll always try. Yeah, okay, so back to, oh gosh, sorry about this, just moving along. Okay, so your house is an option. There's also other things like co-housing. The Golden Girls model is trying to take off. They keep on talking about it. Somebody just needs to get that off the ground. There's things in Ottawa now, we've been approved to do for a couple of years now, to do these kind of coach houses where they put tiny houses in the backyard. Personally, that works for some people, but you need to be really, really, really careful about the social isolation, because, if you're going to move mom and dad to your place and you're going to create a tiny little house for them in your basement or in the backyard or wherever you're going to put it, you're defeating the purpose in terms of that social connectedness. If they can't get out, then the last thing you want is them in a little house in your backyard, without that social connection, right? So just be mindful of that. There is something called supportive housing. Let's actually link that up with active adult communities. So active adult communities are a new thing that we're going to start to see, and we're going to start to see a lot of these. They're coming in hot. They're more apartment buildings for 55 plus. They look and feel like a condo, but they have more amenities, more social. There might be some sort of food or fitness included into it, but they're not a retirement home, total independent living. But you're going to start to see these things pop up almost everywhere. Interesting one that's opening. They have this little like bungalow village for 55 plus. That's a rental coming into Winchester. It'll be, I think at the end, 400 little bungalows with like a big clubhouse in the middle. So those people that are relatively independent and can live on their own, that, the house I'm alone and feeling lonely in my big house. Being in a community like this, you still get the house feel, but you're in an inclusive community with other supportive people around. And usually in those communities, they bring in services and they do a share care model where, you've got shared housekeeping, shared home support, there's also all sorts of shared, financially shared stuff going on in those. Then you have retirement residences. So in Ottawa, we have over 100 retirement residences. It looks like almost on every corner, there's a retirement residence. Now, retirement residence is great as an option. Most people that move to retirement residence need some help with like medication. They're looking for the social, the medication, assisted living, and so on and so forth. Their retirement residence can be a little bit more hospitality focused, where they're beautiful, beautiful buildings offering 3 meals a day. they have all the nursing support and so on and so forth. They offer some of them offer the same levels of care as long-term care, but long-term care is that kind of later, heavier level of care where the government pays for all the care and services and the person co-pays for the meals and accommodations. Lots of eyeballs around retirement and long-term care in terms of COVID these days. You know, if you were to talk to me in the summer, I would say retirement residents actually did really, really, really well in the spring when COVID hit and everything was shut down. In Ottawa, I believe only out of the 100 or like 90 to 100, only about 15 of them saw any sort of case in the building. A lot of what you saw on the news was long-term care. They were de-building long-term care with poor ventilation. They need to be completely flipped. I could go on and on and on and on and on about what's going on with that, but that's probably a different time. That would be a sidebar, call me later conversation. What you need to know about senior housing, I kind of just explained that. I guess one of the things I would suggest is that when you're searching up senior housing, call Solva, because we're gonna give you the honest truth and help you figure out all those options because they're all different. You're absolutely welcome to call Solva in terms of long-term care. Again, we can help you understand it. And you can call Solva for aging at home. But if I was looking at senior housing, one of the things I would look at, and a lot of people don't, is I'd look at the public reports. There's lots of free public reports out there. Here's a link to all of them. And you can see what the last inspection said. You can see what has happened in public health and stuff like that. In fact, you can go to public health right now and see all the buildings that are in outbreak. And when they started and when they got off of outbreak. I guess this is more towards retirement homes and long-term care, but you could do the same thing when it comes to home care. You know, what are the differences and how do I compare them? Long-term care is a bit trickier because they're all governed. They all have the same regulations, you know, staffing, they have to follow certain staffing levels, certain things have to be followed. I mean, I guess in long-term care, one of the qualifying factors is age of the building, like the infrastructure, is it new? I mean, certainly with COVID, like things like ventilation and stuff like that need to be factored in. But then, you know, ownership, that's always how, so my background is actually long-term care management. I spent a lot of time working in long-term care when I was younger, and I took long-term care management with the Canadian Healthcare Association, thought I would be an administrator. And I always said, you know, the only qualifying difference really is building structure and ownership. Is it a public nonprofit municipal building, or is it a private company that owns the long-term care facility? And both exist, and a lot of people don't know the difference. When it comes to home services, you still need to do due diligence. The thing is about with long-term care and retirement, there is legislation and governance, and there is at least some reporting and so on. When it comes to home care, at least private home care, anybody can open a home care company. There's no barrier to entry. You could be Sally Joan Low down the street and open a home care company. So you absolutely should probably even greater do more due diligence on private home care companies. The thing about it is that when you are paying for home care, if that's a road that you go down, if you do pay, remember Lynn does provide some funded services, but if you decide you want more, you're absolutely in every right to interview and select who the caregiver is. And some people don't quite realize that. They pick an agency, they call them up, they like the person that comes out or talks to them on the phone, and then they send somebody. And whether or not you have a rapport with this person, they just send them. But if you're paying for the service, you absolutely should vet who the person is coming into your house to do the service. That was my rant about that. I guess just a little blip on my tips on financial planning. make sure that you compare apples to apples out there when you're looking at services and anything you have to pay for, because some people will offer a lower, just like, I guess, just like contractors, right? Like you're getting something done on your house, you get 3 quotes, you have to sort through, one guy's going to give you the cheapest quote, but he's might not do good work, but he also is going to charge you extra for everything, when in fact you end up paying more than the most expensive quote you had. So you need to be really kind of careful with that when you're dealing with private sector services. And again, Solva can help you sort that out. Advanced planning. So we're just going to round out the end of the presentation, and I like to do it with talking about planning. I think planning is really important, and I think more people need to do it. When it comes to planning, I do believe there's 3 or 4 stages of elder care, and this is something I probably talk to a caregiver about. Pre-elder care might be where some of you guys are if you are seniors yourself. So like you don't need any help. You're totally fine. You're driving, you're living your life. I'm pre-elder care. I don't need anything right now. My mom, she's 77. She drives around. She's pre-elder care. Early elder care is when there's like some physical or cognitive needs. They're starting to emerge. Social isolation could become an issue here. And then you've got moderate to late elder care where intervention is needed immediately. And this is where you go to you had the fall, you had the situation, and they flag you at the hospital and say, you really can't go home. So, yeah. So the making of the plan, I want to talk, so to make the plan, you're going to go back and look at, the reasons why you might have to move. So the social isolation, having a sense of purpose, eating well. How are you going to get food if you can't get out? How are you going to cook the food? Is your home accessible? Doing the home accessibility audit. Do you have emergency support? Having a fall detection device. Is there any physical or cognitive needs? And then bringing in supplements for those. I want to tell you a story this is the most extreme story that I've come across since Solva started. And this is kind of a story of ambivalence or denial. Sally and Betty Smith, they lived in Vancouver. Aunt lived here in Ottawa. Aunt was living with a partner. They both had dementia. Unfortunately, the one partner had passed away, which brought Sally and Betty to Ottawa because their aunt also had dementia and could not go home. Well, when Sally and Betty got to the home, the stuff they found was wild in terms of not knowing what was happening, to the point where they found paperwork, all sorts of paperwork all over the place. But then they're like, okay, Aunt Brenda just bought a car. Where's the car? They couldn't find the car. I don't even know if they ever found the car. Things like, food everywhere and the mess that they were living in. So you need to be on top of this stuff and get and see what's going on. And you need to know the signs if you're a caregiver of, the changing cognitive, physical signs. And there are signs, things like not eating well. You can go into somebody's fridge and see, is the food in here expired? And if it is, why? Is it because they can't go out and get food? It's because they're not hungry? Is it because the lack of motivation? So there's lots of further exploration that we can do. So making a plan, if you were going to make one, like I said, I would start with putting that sheet on the fridge, and you're going to put your emergency contacts, and then, your medication and your doctor and where your lawyer is, getting your financial documents organized. I actually my mom's 77 and she's a bit of a paperwork hoarder. She keeps everything. And so I dread the day, and I don't know where any of her stuff is at all. And so and I know it's not organized, so I know that I'm gonna have to go in there and try to find it. And that's the last thing you want to do when somebody's like in a compromised situation, is you don't want to have to go in and spend hours finding stuff. You want to be with them, right? Where are the POA documents? Having copies of those somewhere easy to get. Review how you want to live long term, and maybe even having a plan A, a plan B, and a plan C. And the plan B and C is like the contingency plans. So like if and I know I don't want to, but if I had to go somewhere, where do I want to go? Because if you don't know and a crisis happens, you might not get all the choice you want, right? Audit your home early. Go have somebody come in and do it now when you don't need any services or any help with anything. And I would even look at, like I said, the plan B and C is your contingency plan. So look at retirement homes, think about long-term care now. You might never want to go, but the thing about long-term care is this. Some of these long-term care facilities have like 5-year waiting lists. And I had people call me all the time to talk about long-term care, and they say, I tell them it's a bit of a strategy. Like you have to go on the list for long-term care early if you want to get into the place that you want your loved one to live in. So you can't wait and say, okay, well, I'm doing just fine at home right now. What if that changes in 4 years? The thing about long-term care is you can always go on the list and you can always say no. But if you don't go on the list and you need it, you're not going to get the option you want, most likely. And like I said, write everything down and leave it where people can find it. Make copies of your plan and review it with others. And that's it. Any questions? If you want to put it into the chat room, that's probably the best place for me to find questions. No questions. Okay, so, I think there is a question. Here we go. Oh, thank you guys. Yes, absolutely. I will send you the slides. They have the links in there that you can go. I think honestly that AARP document. AARP is an American company. It's the same. We have something called the Canadian Association of Retirement Persons. ARRP is the American version of that. So I'll make sure that you get that doc for sure. Okay, everyone, thank you so much. And anytime you have a question, don't hesitate to let us know. Okay, and we'll send this along. Bye.